just to let you just sent the statement of the emergency committee, so you should have it in your inbox. We will go to next question. That's Gabriela Sotomayor from Mexican news agency. Gabriela, can you hear us? You need to.
Hola, hola.
Hola.
¿Me escuchan?
Can you hear me now? Good. Thank you very much for giving me the floor. It's a pleasure to be able to speak in Spanish. Our concern is that in Mexico, the death rate is of 9.4 in Mexico. It's much higher than in the United States, for instance. So I'd like to know what you know about the situation in Mexico and what's being done in terms of the lockdown, and that there aren't tests being carried out. There haven't been very many tests carried out as you recommend. So what risks are there of just following one strategy? In other words, if you had to choose between a lockdown and public health measures, including testing, which one?
So I can start, and perhaps Mike or DG would like to supplement. So you had a couple questions in there. The first one about mortality. I think we've spent a little bit of time of trying to describe the difficulties in estimating mortality as events unfold. There's quite some variation in mortality by country if you actually look at how many, if it's defined as how many deaths are reported, that are reported. And there's challenges with that. One, depending on the testing strategy and how much testing is being done, you may be missing cases that are on the more mild end of the spectrum, and so that's important to understand. In terms of capturing deaths, many countries right now are struggling to capture the deaths that are occurring from COVID-19. There's a very good example across Europe through the MOMO project, which is capturing excess mortality in many countries across Europe. And excess mortality right now is very high. And so I think it will take some time for us to really understand which deaths are due to COVID-19 directly in terms of the infection, and which of the deaths are associated with COVID-19, either because somewhere for some other reason. And I think it's going to take some time. So we have to be careful when we compare from Mexico versus mortality from the United States versus mortality even within a country. And so there are some challenges there. Your other question about whether we do testing or whether we do public health measures, that's not the right question, unfortunately. It has to be all of these measures together. It has to be. Testing alone does not work. Contact does not work. Lockdowns alone do not work. It has to be part of a comprehensive strategy. Testing needs to be strategic. It can't be testing every single person in the population. It's just not feasible. It's just not possible. We have tried to be very clear in our testing strategy and prioritizing your tests for suspect cases, testing suspect cases and contacts who develop symptoms. That's in situations where testing may become challenging because the tests aren't available or the reagents are, the swabs are not available. Then you need to be more strategic, even more strategic, and individuals who may develop severe disease and require care, maybe focusing on more intensively on healthcare workers. And so it's a much long-winded answer because it's complicated. It depends on the situation that you're in, but it has to be a series of measures that are put in place. It cannot be one situation, one measure alone. The DG has said not testing alone, not contact tracing alone, not isolation alone, not quarantine alone, not lockdown alone. All of these measures is important. Hand hygiene is important. Respiratory etiquette is always important. So it's all of these measures that need either intensifying them or lifting them.
Just supplement very quickly, and from the perspective of the situation in Mexico, there have been 16,752 cases in Mexico as of yesterday, with 1,500. It says up 83%. So there's no question that in the case of Mexico, this is still a very active epidemic in Mexico. I don't have at hand, obviously, the subnational data, so I won't speak to the different patterns that may be occurring at the state level. When you calculate fatality of those confirmed cases and deaths, that case fatality is of 9%. And that can mean a number of things, but what it usually means at this stage in an epidemic is that there's under-detection of the milder cases. That's what we see in many situations, a higher case fatality, and then as you test more people and you detect more mild cases, that proportion drops over time. It can also reflect, and has reflected, as you've seen around the world, that when the health system comes under pressure and intensive care patient outcomes can be affected by the lack of oxygen or the lack of availability of ventilator. So I would say that Mexico is like many countries in Central and South America, is on an increasing trend. More needs to be done in terms of surveillance, testing, and obviously our regional office for the Americas, the Pan American Health Organization, is working very closely with authorities in Mexico to support them in improving surveillance and improving patient outcomes. And I know that Mexico has at least 9 registered trials, clinical trials, and has shown interest or has requested to be part of our solidarity trial. So we thank Mexico for that. We thank Mexico for its openness and data sharing, and we will do all that we can to support their response, because right now the situation in Mexico is still evolving, and obviously more needs to be done to bring the disease under.
Thank you very much, Dr. Bunker. This question is coming from Malaysia. Randy, hear us? You would need to unmute yourself.
Oh, sorry. Yeah, I can hear you now. Yeah.
Yes.
Yes. For taking my question from the Telegraph. My question goes to the WHO in Geneva. So, a question with regard to the spread of the virus in prisons and mental health institutions in Indonesia, the Philippines, and basically the rest of Southeast Asia. So, how worrying is this situation in the region in general, do you think? And what do governments in the region have to do more to tackle this crisis that might be taking place in those facilities? Thank you.
Thanks for the question. I don't have specific numbers on the impact in prisons or mental health institutions in countries in South Asia, but it's something we've issued guidance on in both cases. It's a concern. We've said the same about long-term care facilities in Europe, dormitories for migrants in many countries in the Middle East, in South Africa, in Singapore, prisons all over the world. We've talked about cruise ships and other types of vessels. We've talked about any long-term care facilities. And the reason why we've spoken and we've been so concerned about these facilities for 2 reasons. One is that if a disease gets into a closed community, the disease spread very quickly. In fact, one of the most successful programs for doing sentinel surveillance for influenza over the last 30 or 40 years was using boarding schools to check for the disease, because once influenza arrived in a boarding school, it spread like wildfire. So you could pick up a signal of the arrival of influenza in a country by these groupings of people who amplified the disease. They almost became like amplifiers. So anywhere where people come together, a respiratory illness will spread quickly. That's a problem. If it's a young, healthy community that are infected, then obviously the impact may be less, but at the same time could be significant. When that to an institution or a facility in which there are many vulnerable people, be it people with underlying conditions, older populations, then the impact of the disease, not just the mission, is great. And I've said this before at these press sessions. It doesn't matter if you're in prison, it doesn't matter what your crime is. All citizens and all people in society deserve to be protected under the law, and as such there are responsibilities for all those who manage facilities to, number one, try and shield those facilities from disease getting in, having the necessary measures in place to reduce the chance that disease will spread, and that means having the capacity to detect very quickly. And I think one of the things in an institution really, really quickly is the first signal, the very first signal that something is wrong. You need to react very quickly. You need to be able to remove any individual that's suspected of being a case very quickly from that grouping, and you need to test, because a spark in a situation like that turns into a fire very, very quickly. Now, implementing those types of measures, hygiene measures, surveillance measures, and very constrained. It's a very constrained issue because prisons have a limited size. Some countries have dealt with that by releasing prisoners for non-violent crimes or prisoners towards the end of their sentences. That can be done. Authorities in Singapore are working very hard to improve hygiene and physical distancing in the migrant dormitories there. It's much more complex in certain other situations. People in mental health institutions have significant other needs, and they need to have that care and support. So you can't just leave people with support. I think not only are there significant mental health implications of the pandemic itself on individuals, but there are people who have significant problems who need constant support, and it's a very complex issue. How do you reduce the chances of infection in these facilities while still being able to deliver adequate care? Speaks, I think, in the long run to the whole concept of large-scale institutionalization of people with mental health difficulties. I think we need to find more sustainable solutions for dealing with those in our society who suffer health illness, and large mental health institutions in which people are sometimes abandoned is not necessarily, not only from an epidemic point of view, not a good societal solution for dealing with those in our society who are unfortunate enough to deal with long-term mental health issues.
Thank you very much, Dr. Ryan. Next question is from Laurent Sierra. Laurent, please, if you hear us, go ahead. Laurent,
can you hear me?
Yes.
Yeah, thanks for taking my question. Question to Dr. Tedros. You briefed again the missions yesterday. I was wondering whether the countries whose leaders have been vocal in criticizing WHO, like the US and Brazil, are still actively taking part to these briefings, or do you face boycotts, and what kind of engagement are you able to maintain with these countries?
Yeah, thank you. Thank you for that question. We contact and we work together.
Thank you very much. Let's try to go to Morocco, and it's Morocco World News, and we have a Kristen Janaris. Kristen, can you hear us?
Yes, I can.
Yes, we can.
Thank you so much for taking my question. My question is regarding the WHO and EIB support for, you had mentioned 10 African countries. I'm curious as to which countries will be supported by this partnership and what selection criteria is for them.
Thank you very much. Do we have Mr. Hoyer online? Maybe Mr. Hoyer would like to start.
I'm in, but I must disappoint you because this communication has not gone to respective governments yet, and therefore for the time being, I cannot respond to this. And together with the WHO, we will do that within the next couple of days.
Okay, thank you very much, Mr.
You good?
Jamie,
yes.
can
you hear me?
Yes, now it's okay.
Okay, great, thank you. Hi, thank you very much for taking my question. I have for Dr. Tedros and then a follow-up to Dr. Hussein. Does WHO believe that the Wuhan Institute of Virology was the origin of this coronavirus? And what are you doing to try to find out if it was?
Thank you, Jamie.
And just a quick follow-up for Dr. Hussein, because there was a very interesting question from National Geographic earlier, and I just wanted to make sure that we followed up on that. President Trump, Dr. Hussein, you mentioned lucidité a posteriori, which could be translated as hindsight is 2020, I think. President Trump has been very severe with WHO and Public Relations Agency for China. How much should the Emergency Committee also be taking some of the heat from President Trump for not having stepped up earlier? And can you tell us which of your members spoke out against declaring a fake on 22nd, 23rd of January? Thank you.
Thank you, Jamie. We said one question, analysts. Thank you.
I was a follow-up.
Professor Hussein, do you want to?
Well, again, I must say that I am not entitled to discussions which occurred during the emergency committee because there is a confidentiality agreement which was signed. So I shall not say what was the position of the members. During the press conference on the 22nd and 23rd, I said that the committee was 50-50 and that there was a need to find a consensus to provide an advice to the DG. And at that time, the consensus was that it was a bit too early to declare a fake because there were 4 cases abroad and that it be re-examined, of course, following a few days. Nevertheless, as said Dr. Tedros, were made which were allowing to start all the measures necessary to implement in such a situation. So this is the only thing I can say on this matter. For the political, I think Dr. Tedros is perhaps better placed than me to respond. Thank you.
And I can take, welcome Jamie. Press conferences aren't the same without you, so thank you for your question. With regard to the origins of the virus in Wuhan, we have listened again and again to who've looked at the sequences, looked at this virus, and we are assured that this virus is natural in origin. And what is important is that we establish what that natural host for this virus is. And the primary doing that is to ensure that we understand the virus more, we understand human interface, and we understand how the animal-human species barrier was breached. And the purpose of understanding that is the necessary prevention and public health measures to prevent that happening again anywhere. And that's that is what we are pursuing that and working and offering support to authorities to carry out such studies that will allow us to determine those very important outcomes, which will help us determine what the right steps are to ensure that this does not happen again.
Thank you very much. Next question is Xinhua News Agency, Mr. Wang, if I'm not wrong. We will try to get connection to Xinhua. Yes, please.
Okay, thank you for taking my question. The question is for Dr. Tedros. In Wenzhou, China City, once hardest hit by the epidemic, the number of COVID-19 patients in serious conditions has dropped to 0 on last Friday. So what is WHO's comment on the response efforts in Wuhan? Thank you.
I can start. I mean, that's very, very welcome news to hear that there are no more severe cases, no more patients in Wuhan. China has worked very hard to bring the outbreak under control. was there for 2 weeks and working directly with ministry officials and officials from all different sectors, from hospitals, through communities, to really see what was put in place to bring those numbers down. And we have learned, the world has learned, as it has from all countries that are dealing with COVID-19. And it is welcomed news to hear no severe cases in Wuhan. That really has had the hardest hit early on. There are a number of cities that are dealing with this now, and we need to continue to learn from Wuhan and how they are lifting those measures, how they are already back to normal, or a new normal in terms of how we are going to live with this virus going forward. But we welcome all actions by all that are putting in place measures to suppress transmission, to identify patients early so that those early patients don't progress to severe disease. We welcome the innovation and the treatments that are in clinical trials right now that are looking so hard to find treatments to prevent people from dying from COVID-19. We welcome all, and we thank the healthcare workers who have put themselves on the front lines to be away from their own families to care for patients, to prevent those individuals 19 from dying. So nothing but admiration and thanks for the tireless efforts of the people of Wuhan, not just the healthcare workers, but the who stayed in their homes, who adhered to the public health measures for extended periods of time. We take our hats off to you, and we thank you for your commitment and your service, and for sharing with us and the world what you've been able to do. So congratulations to Wuhan on this. And we know that you will remain vigilant to find any additional cases that come, because this is far from over. And we know that. Everyone stands at alert to find cases as quickly as possible.
Thank you very much. We have time for one or two more questions, so we will try to go to Spain now. Cristina Masdiaria. Cristina, can you hear us? Hello, we are trying to get Cristina from Spain. Yes.
Yes. Yes, hello, can you hear me?
Yes, we can.
Thank you for answering my question. I would like to ask Dr. Maria Van Kerkhove if she could to understand where are we now in the evolution of the pandemic. If you can help us to have a portrait of the current situation in a world level. Thank you very much.
Thank you for the question. That's a difficult question in terms of where we are in this evolution. So we are clearly many countries are in the difficult time right now in terms of dealing with this outbreak. Countries across Asia have had their first wave of infection, and many have been able to suppress the virus, have been able to bring the virus. We are seeing some countries which have seen a resurgence, namely in outbreaks and clusters of cases, either in expat dormitories or in major cities. And so we're learning. In Europe, we're seeing a stabilization in many countries. We're seeing a decline in others. And so that is welcomed news, but many countries have imposed very strict public health and social measures, or so-called lockdown measures, and are looking at those. So we cautiously need to see how that will impact the virus in terms of its ability to transmit further. We are seeing increases in a number of countries across the Americas, and we've covered a couple of those today already, but there are many countries which are seeing an increase, which is a worrying trend. We're seeing a number of countries in the Eastern Mediterranean region see a stabilization and a decline in their cases. And again, this is welcome news in terms of their ability to suppress this virus. But again, they have also imposed strict public health and social measures. So we need to watch with caution as those increase. In the situation in Africa, there are a number of countries that are still seeing low numbers of cases, and there are opportunities in Africa, in many countries across, able to prevent the ability of this virus to take off. A complex picture across the globe of where we are. I think it is very clear that we have a long way to go. The early seroepidemiologic investigations that are being conducted are indicating to us that a large proportion of the population remains susceptible, which means that the virus has the opportunity to infect more people. So it's important that we remain vigilant and keep in place their workforce to detect the virus, to detect people who have the virus and care for them appropriately, to isolate them, to find and trace all contacts and quarantine those, to ensure that the public is fully informed of the situation in each country and at the lowest administrative level, because it's important that the public thus in this and really understand that we have a long way to go. And so we do see encouraging trends, and I think we need to celebrate those successes, but we need to remain humble and we need to remain vigilant, because this virus likes to find the cracks and those cracks and find every opportunity to take off if it can. So we must do everything that we can to prevent that from happening.
Can I just supplement? Marie's given an excellent overview. I just want to highlight one particular situation that we've become increasingly concerned with, and that is the rising number of cases in countries affected by fragility, conflict, and with high numbers of vulnerable populations, refugees or displaced populations. Over the last week, a number of weeks, we've seen worrying increases of disease in Haiti, in Somalia, in Sudan, in South Sudan, in Yemen, in Syria, in Afghanistan, in Sierra Leone, in the Central African Republic, and most recently investigating a serious cluster of respiratory disease in adults in Kano in northern Nigeria. We remain deeply concerned the impact that this disease will have in communities who are already greatly underserved, have many underlying conditions, and it's a real concern for the humanitarian community. And I know Mark Lowcock, the Under-Secretary General in Affairs and the Director General, launched a humanitarian appeal a number of weeks ago now. There's still a lot of work to do in countries. We need to get access to all populations in all countries, and we need to be able to deliver essential health services as well as COVID response. I think it's truly important that this happens, because these populations too much, and the extra impact of COVID-19 at this point can be avoided if we rush to provide the extra support that's needed for these people who live on all sides of conflict. And as the Secretary General has called for de-escalation of conflict in these situations in order for a proper clean response to be mounted. No one on this planet will until everyone is safe, and we cannot let this disease spread unchecked in these communities. It is neither the right thing to do, nor is it the smart thing to do.
And maybe we take last question before we finish here. Catherine Fiancan from France 24. Catherine?
Yes, do you hear me? Hello? Do you hear me?
Yes.
Okay, good afternoon. Thank you for taking my question. I would like to come back on the lifting of the lockdowns, because as you know, on May 11, the countries that have been the most hit by the coronavirus in Europe and in the United States are allowing kids to go back to school and some people to open the restaurants back. So I would like to see you to remain us what you know about the children, in order to for parents not to be nervous that children cannot be affected, that they cannot transmit the COVID. So could you please tell us what is exactly the knowledge, what you know about the virus for the moment? How long does the virus stay alive on the surface? Do you have an idea? Do you have a precise idea for the moment? Thanks so much to you.
So thank you for the question. This is an important question. As you know, we are learning more about this virus every day, and we are all concerned about the impact of this virus on children. What we know from data from all countries that we are receiving data from is that children appear to be less affected, and developing disease. And that means when you look at the number of cases that are reported from all countries, a very small proportion of those are children. Between 1% and upwards of 5% are among children up to the age of 18 and 19. So it's a small proportion of the total number of cases detected. Among those children who are identified as having COVID-19, the vast majority of them develop mild disease and recover. And that is very important. We are trying to understand why that is, and there are studies that are underway to better help us understand that. There are some children, some who have had underlying conditions, others who have not, who have developed severe disease, who have had critical disease, and some children have died. Universally, that it's a mild disease in children. But the vast majority of children who have been having COVID-19 have mild disease. You heard of a report the other day of an inflammatory disease in some children that was identified in the UK. Now that is significant in the sense that we have astute clinicians and nurses and healthcare professionals who are looking at how this infection is impacting the body, and they picked up a signal. This may be having to do with COVID-19, or it actually may not have to do with COVID-19 at all. Our clinical network, which is our global clinical network, is raise the alert and say, please look at our colleagues in the UK for raising this so that we can better understand anything that is actually related to COVID-19. So just to summarize on the disease, the overwhelming majority of children who are detected have mild disease, and that's important. Children are susceptible to infection, which means that they can get infected. And from the studies that have been conducted, which are well-designed studies in households, for example, they've looked at if adults are transmitting to children or are transmitting to adults. And in most of those studies, it's adults transmitting to children. In some instances where they're suspected that the children infected the adults, so it can go both ways. Again, we need more information to better understand this, but susceptible, and they can get infected with this virus. They do tend to have mild disease.
Thank you very much. We will conclude today's press briefing. I will just ask Professor Houssin and Mr. Hoyer if they would like to add something at the end. Maybe we start with Professor Houssin.
Very much. I have nothing to add. I think everything was said. Thank you.
Thank you very much for your participation, Professor Houssin. Mr. Hoyer, would you like to have some final words?
That we are going to start.
We didn't hear you. Can you just repeat, please? You were on mute. Sorry, can you time because we couldn't hear? Unmute yourself, please.
Something seems to be wrong with the unmuting here.
Now it's okay.
Better now?
Now it's okay.
Okay, so just thank you very much for the opportunity to start a great cooperation.
Thank you.
Good luck for your work.
Thank you very much for your participation.
Thank you, Professor Houssin, and also my friend Warner, and to thank all who have joined. And I would like to wish everybody happy Labor Day. Have a nice weekend. This too will pass. And the antidote is solidarity. Let's stay together. Thank you so much. Day.
And we will have an audio file available very shortly and transcript hopefully tomorrow. Have a nice weekend.
American people. That was quite apparently false. On January 14th, again repeated China's talking points about no human-to-human transmission. On the 22nd of January, on the 23rd, they said the pandemic didn't represent a public health emergency of international concern. And even on February 29th, you had the WHO saying that when the coronavirus was spreading around the world, they political correctness first by opposing life-saving travel restrictions. The travel restrictions the president put in place, the travel restrictions that Dr. Fauci praised as saving lives. World Health Organization opposing a measure that saved American lives. That's unacceptable, especially at a time when the U.S. was providing $400 to $500 million. John.
Kayleigh, this time last week, the president was saying that he was not happy with Georgia's Governor Brian Kemp for beginning the reopening process at the time that he was. A week later, there have been some peaks and valleys. The trend line is down. Do you know what the president's thinking about the Georgia reopening is as of today?
The president is resolute in saying that the states here. It's the decision of governors to decide what is best for their state. That being, I talked to the experts. I talked to Dr. Birx. I talked to Dr. Fauci, and they say, rightfully so, this president has always sided on the side of data, which is why he encourages all states to follow the data-driven guidelines to reopening. All states from Georgia on down the line should follow those guidelines, but ultimately it is the decision of the states. And one note I would make about the president, in times of national emergency, we seem to have had a trend in this country where presidents aggregate power at the federal level, but this president has devolved power. He's invested in a principle that I cherish, and I know many others do, which is federalism, and I think that was the right decision.
Has he mentioned how it was about Governor Kemp in the last few days?
I have not spoken to him about Governor Kemp in the last few days.
As the on the lines of reopening, as the president pushes forward to reopen the country, does that mean he'll be campaigning in those states where that will be reopening?
So I would refer you to the Trump campaign on that question. Yeah.
Yeah. Thanks for being here, Kayleigh. You mentioned Dr. Fauci a minute ago. Are we press briefings with Dr. Fauci and Dr. Birx and the health experts, or is the White House kind of, focus more on the economy and less on the public health aspect?
Well, let me back up and talk to you a little about the approach to disseminating information. When I talk with my colleague Alyssa and we plan out the communication strategy for this White House along with the president and Ben as well, what we do is we mode for the public to receive this information at this time, and we allow the news cycle and the needs of the American people. And at the moment, what we see happening, and I hinted at this in my gaggle last week, is you have 35 states and probably more at this point with plans to reopen the country. Americans are looking to reopening the country. We've had Dr. Birx in several events this week. They've been Dr. Birx and Fauci out on the airwaves. They're really incredible people and have done a great service for this country. But we allow the news of the day to guide us, what the American people need to hear. And right now we're in a reopening phase, which is why you've seen the president this week with CEOs. You've seen him with small business owners, with small business employees. Today with some great heroes that have emerged from this pandemic and have done a lot of the hard work. So every day we approach this as, how can we disseminate this information? There's a need for information, which is why I'm here supplementing the efforts of this president to get the message out. I would also note he's the most accessible president in history. Took questions twice the day before. You hear from him quite often, as well as our medical experts.
So is the task force still meeting? I guess what's the role of the coronavirus task force? We still have hundreds of people a day are dying. So what role does the task force have versus the economic advisory groups?
Yeah, the task regularly. I go to those meetings. I hear them. Dr. Birx, I should say, is meticulously reviewing the data in granular detail. I watch them spend sometimes the task force briefings. So those are still ongoing. Rest assured. So we are prioritizing the health of the American people as well as looking forward to reopening.
Yes, thank you, Kayleigh. Back to the DNI statement from yesterday. There is a quote you to give me a response to. It said, the intelligence community also concurs with the wide scientific consensus that the COVID-19 virus was not man-made or genetified. This was from the DNI statement. How do you see this statement? How do you understand this? And also there was a piece in the New York Times. Trump administration officials have pushed intelligence agencies to hunt for evidence to support the theory that COVID-19 was made in a Wuhan laboratory.
I can assure you that no one is pressing the intelligence community to come to a determination. The intelligence community statement stands. It's in. So, I encourage the media to convey the facts to the American people, which is that we're in line as an administration and we stand by the intelligence community, and that is in complete concert with what the president said yesterday. See, who haven't I gotten to? Oh, I've gotten round two. That's great. Yes.
Thank you. Today, former Vice President Joe Biden denied allegations of sexual misconduct against him. Does President Trump take him at his word, given that, as the president has said, he has denied allegations against himself?
Well, what I would say is that we are pleased that the decided to go on the record. It took him less than, 16 hours to follow the advice and come out and publicly address those claims. So, we're glad to see that he's on the record on this.
Let me just ask you about something the president said moments ago in an interview. He said that Tara Reade is, quote, far more compelling than anything with respect to Brett Kavanaugh. What did he mean by that? What is more compelling?
That's the president's assessment, so I would point you back to his words. I think it was a grave miscarriage of justice what happened to Brett Kavanaugh. There's no need for me to bring up some of the salacious, awful, and verifiably false allegations that were made against Justice Kavanaugh. That was an embarrassment for the Democrat Party to have a very respectable man through the mud like that. So I'll leave it at that.
Radio Fuller, I'm asking this on behalf of our colleague. There's word the decision to release Michael Cohen from prison to home confinement due to COVID-19 has been reversed. Did the White House directly or indirectly intervene here?
No. So absolutely not, I would say there. But I am glad that you brought up justice, and because, look, there's, again, a case of injustice that is yet to be brought up today, but I certainly would like to bring it up, and that's the case of General Mike. What we've all learned from that should scare every American citizen. The fact that you had Jim Comey admitting in December of last year that he violated a protocol by directing agents to confront Flynn, something that he would not, quote, have gotten away with administrations. The FBI told Flynn he didn't need a lawyer when they came to meet with FBI agents, that he didn't think Flynn was lying. And then all of that information we learned over the last few months and years culminates in the fact that we have a handwritten FBI note that says, quote, we need to get Flynn to lie, quote, and get him. There was an unfair target on the back of General Michael Flynn. It should any time there's a partisan pursuit of an individual, and that's certainly, at least those questions are raised with regard to General Michael Flynn, an honorable man who served his country. John.
The president fired Michael Flynn. He said he was doing so because he had lied to the vice president and he had lied to the FBI. So, given all that you've just said, isn't it still true? Doesn't the president still believe that Michael Flynn lied to Vice President Pence and lied to the?
Well, first, let me address that. Vice President Pence is on the record about this. He said he's inclined to believe that Flynn did not intentionally mislead him. And I guess I would turn the question on you and just ask, does it trouble? We got to get Flynn to lie. Doesn't that trouble you as a journalist? And not only that, as an American citizen.
Well, it's certainly something worth reporting. It's not my job to say whether or not it's troubling. But the bottom line is the president said point blank that Flynn lied to the FBI and to the vice president. I'm just asking a very direct question. Does he still believe that Michael Flynn lied to the FBI and lied to the vice president?
President's statement that he's inclined to believe that Flynn did not intentionally mislead him. And I'm asking back that all of you in your coverage endeavor to report what is a very CI is saying, let us get someone to lie. I've seen very scant coverage of that. It's a story worth reporting, and a story that I hope the American people, if you haven't heard it yet, are getting to hear for the very first time.
Thank you, Secretary going back to the South, we had an issue come up this morning where you had the USS Barry crossing maritime waters, and then this is in the South China Sea. And Chinese officials are saying that a dead-end endeavor. Has the president spoken with any side on the Chinese as far as the United States is going to continue doing? Is the U.S. Navy going to just ignore these threats and keep going through these international waters? What are your responses to China's increasing aggression in the South China Sea again?
I have no news to report as to the president's conversations, and for the specifics of that, I would redirect you to the NSC. Yes.
Thanks. In the same podcast interview, the president said that Democrats would, quote, have to give us a lot for aid to to states. I'm wondering if you have any idea of what specifically the president is asking for, and secondly, what you'd say to somebody like Governor Cuomo. You know, the president's already told me, you know, a few weeks ago that he would support this type of assistance, and why are we bailing out, you know, airlines or defense contractors, but not the states that pay teachers or first responders?
Well, first, you brought up Governor Cuomo, so I just thought it's a good. Governor Cuomo has praised the president's response in this COVID-19 crisis, saying that what the president has achieved is a phenomenal accomplishment, and we thank Governor Cuomo for those very kind words. But on that note, with regard to funding to states, Phase 4 is something that I want to start negotiating on immediately and get to work on. The president has said, look, I will certainly look to consider helping states who have coronavirus reasons for the financial situation they find themselves in, but he doesn't want this to be an excuse for decades and decades of bad Democrat governance that have run some of these states into a financial predicament. So he has mentioned that in terms of the types of things he wants to see in this Phase 4. I don't want to get ahead of the negotiations, but I do want to emphasize that he has mentioned this is a really important issue that has cost American lives. Last year, a brave ICE officers arrested more than 120,000 criminal aliens charged with nearly 10,000 burglaries, 5,000 sexual assaults, 45,000 violent assaults, 2,000 murders, and in the last year, egregiously, 5,000 human trafficking episodes. So American lives matter, our brave ICE men and women matter, and it's something that he'd like to see in a Phase 4.
I mean, you raised that, and the president's been kind of explicitly conditioning state aid on states or cities, not saying that they would have sanctuary city policies.
No, I'm not. No, not conditioning anything, but saying that is a negotiation that the president will certainly bring up.
Thanks very much. So the president has in the past denied any of the allegations from the many women who have accused him of sexual misconduct. But per that podcast today, he seemed to suggest the allegations that Tara Reade has raised are more, what are these, credible than the ones against Brett Kavanaugh. What about the allegations that were raised against him, however? Why should the public, or what makes them any less credible than the allegations from Tara Reade?
The president has swiftly denied all of these allegations that were raised 4 years ago. He has all issues. He's denied them immediately, and you're bringing up issues, like I said, from 4 years ago that were asked and answered, and the American people had their say in the matter when they elected President Trump as president of the United States. But, you know, the media, leave it to the media to really take an issue about the former vice president and turn it on accusations from 4 years ago that were asked and answered in the form of the vote of the American people.
Just come back, Haley, to John's question, because Kellyanne Conway spoke to this the other day and suggested that two things could be true at the same time. We now have the vice president saying it's his belief that General Flynn may have unintentionally misled him. That's now 3 years after the fact. But the two things that could have been true at the same time were that Flynn lied to the lied to the FBI. If you remove the FBI piece of that, would the president still have fired Mike Flynn for his belief that he lied at that point to the vice president?
I mean, I'm not going to engage in a hypothetical, and that's essentially what that would be. But what I would say is echo yet again that this was a grave miscarriage of justice. FBI thought to keep a paper trail because what many have said for a very long time, pointing to, shared with you, culminating in that handwritten note. I'm glad they kept such good documentation of their intent to slow walk General Flynn into a trap and to essentially create, as I mentioned, a grave miscarriage of justice. So FBI, at least we can thank you for the great note-taking.
Let me follow up on that, though. John does bring up the point that General Flynn pleaded guilty to lying to the FBI.
I'm not going to get involved in what was a matter of
justice.
It's, do you not consider it a miscarriage of justice when you have the FBI writing, "We want to get someone to lie"? Is that a miscarriage of justice?
Guilty, and then that's...
You hesitated because you know what the answer is. The answer is yes.
That's up to a lot of other people to decide.
And I would encourage you to cover it because I've watched a lot of your networks. I've read a lot of yours. I've seen a whole lot of scant information about Michael Flynn when there was a whole lot of speculation about Russia, culminating in $40 million of taxpayer money being lost and the complete and total exoneration of President Trump. Thank you guys so much. I'm going to short now and go see my little 5-month-old here in a few hours. And let me just say this. The president at 5 p.m. leaves today for Camp David. It's going to be working weekend. He'll be talking with heads of states, with elected officials. We have a great event coming up this afternoon. And of course, everyone should watch the Fox News Town Hall with the president from 7 to 9 p.m. It'll be can't miss television. We rated President Trump coronavirus task force briefings have been. Thank you.
Who will be with us?
So good afternoon. I have an announcement for you on hospital created in the third phase of coronavirus relief. The Trump administration will distribute a $2 billion in provider relief fund payments to 395 hospitals across the country that have been hardest hit by the COVID-19 pandemic. These hospitals have collectively cared for over 70% of the 184,000 Americans that required hospital inpatient care. $10 billion of the $12 billion will go towards hospitals treating 100 or more COVID-19 patients. HHS is distributing an additional $2 billion to these 395 hospitals in proportion to the amount of care they provide to low-income and uninsured patients. This is consistent with our that Americans who need federal government assistance the most receive it. We'll be releasing a breakdown of the states receiving this funding and the counties receiving this funding, but for your awareness, New York, New Jersey, and Illinois receive the most funding by state, while New York, Bronx receive the most funding by county as determined by our metrics. Our healthcare providers, as President Trump has repeatedly acknowledged, are our heroes as we work to defeat the invisible enemy. We'll help these heroes defeat this virus. In reacting to CARES relief, I love what this one. He said, thank you and God for this relief. I have tears in my eyes out of gratitude for these funds. Thank you so, so, so much. Additionally, 100 flights as part of Project Airbridge have been completed to date. These flights have expedited nearly 1 billion healthcare heroes. The third phase of coronavirus relief also included an additional funding for the Paycheck Protection Program, which, as you all know, provides forgivable loans to businesses in order to keep their employees on payroll. This program has been extraordinarily successful. First round of PPP loans, 1.6 million loans were issued to small businesses. Of those 1.6 million loans, 1 million of them were given to companies with 10 or fewer employees. So it has gone to small businesses and businesses that need it most. But the PPP, look, it's not just another government program. This is supporting everyday Americans who, through no fault of their own, have found themselves in this predicament. We saw this firsthand at the White House on Tuesday. On Tuesday, President Trump welcomed small business owners and employees to the White House. These small businesses received PPP loans, which helped them pay their employees during the pandemic. Biddy & Bose was among the small businesses welcomed to the White House. Biddy & Bose employs 120 people with intellectual and developmental disabilities. It's a coffee shop not too far away from here. Bose had to temporarily close its doors, but because of PPP loans, Biddy & Bose was able to rehire all of its employees. I had the real honor of getting to meet Michael Hoyp. He's one of the employees at Biddy & Bose, and he offered some words of encouragement to our country, and they really heart, and I think they'll touch the heart of America, if you guys wouldn't mind playing those remarks.
President Trump and Ivanka, thanks a lot for inviting us. Mr. President, for having us. I love my job and I am excited about going back to work. At Biddy & Bose, we like to use the phrase called not broken. That means me and all my amazing coworkers are not broken and we have lots to offer. I know the great country of the United States isn't broken either. So on behalf of myself, Megan and Amy and all the employees of Biddy & Bose, thank you for inviting us over. You guys are our family.
Michael's an incredible young man. I gave him a call yesterday and he said he and his fellow employees were literally handwriting notes, packages that they send out to consumers. I received one of these notes from another company and it really does put a smile. Michael's doing that each and every day. And Biddy & Bose, they represent the hope and opportunity that is on the horizon. America's workers, as their business embodies the American spirit. Workers like Michael show that this country is not broken and that we will recover together. Michael, thank you. You're an American hero. Thank you for sharing that message of hope. And with that, I'll take questions. John.
Kaylee, if I could, welcome to the podium for the first time.
Thank you.
Mr. down substantially today after the president yesterday suggested in the Eastern that he might use tariffs to punish China over the coronavirus. Is there any serious putting new tariffs on China, or was the president just spitballing yesterday?
Look, I won't get ahead of any announcements from the president, but I will echo the president's displeasure with China. It's no secret that China mishandled this situation. Just a few examples for you. They did not share the genetic sequence until April so on his own. The very next day, China shut down his lab for, quote, rectified information on human-to-human transmission alongside the World Health Organization and didn't let U.S. investigators in at a very important time. So we take displeasure with China's actions, but I certainly won't get ahead of the president with those announcements.
Is the president seriously considering forcing China to pay some sort of compensation, reparations, whatever word you want to put on it?
Again, when it comes to retaliatory measures, I'm on that.
Thank you, Kayleigh, and welcome to the podium as well. The president said yesterday that he has a high degree of confidence that the coronavirus originated in a lab in Wuhan, China, and yet his own intelligence agencies say they're still investigating. So does the president have information, and has he drawn a conclusion that the intelligence community has not yet?
Consistent with the other intelligence assessments, while we continue to have very limited and dubious data from China, current assessments indicated that President Trump's statement is consistent with what some analysts believe is the epicenter of where the virus began. And I would note that intelligence statement you're referring to really made 2 points. 1, that this virus originated in China. 2, that it began through contact with infected animals or was the result of an accident at a laboratory in Wuhan. So I consider that consistent with what the president said, that he's seen intelligence suggesting it could be in the Wuhan laboratory.
Yes. Seem to lean into the idea that this started in a laboratory, whereas the statement that we saw from the DNI said we're still investigating those 2 options that you just laid out. Is the president way creating mixed messaging by not saying we're still investigating?
No, let me remind everyone, this is just an estimate essentially, and it's up to policymakers to decide what to do with that intelligence. In this case, the policymaker is the president of the United States, and he'll make that decision at the right time.
Is the president any close to deciding what to do about it? Has he received any recommendations of the consequences? Is he anywhere near a decision?
Again, I won't get ahead of the president's decision or the timing of that decision, but he takes this very seriously because this of China that I referenced, slow walking some of that information put American lives at risk. And rest assured, this president has one priority, and that is the safety and the well-being of Americans.
Thanks so much, Kayleigh. Welcome. Since it's been more than 100 days since the press secretary stood up there, I wanted to get a better sense of what your plan is. Are you planning to do these on a daily basis at this point? And also, will you pledge never to lie to us from that podium?
I will never lie to you. You have my word on that. As to the timing of the briefings, we do plan to do them. I will announce timing of that, but we do plan to continue these.
John?
Welcome to the podium. A question for you on Project Warp Speed. Can you give us some more details? The president said ultimately he's in charge of this project, but will there be a day-to-day point person on this? What's the budget for this? Can the American people realistically expect that there will be a vaccine available to everyone?
Day-to-day point person, and that's the President of the United States, President Trump. And with regard to, I would note the words of Dr. Fauci, which are these: going into a phase 1 trial within 3 months of getting the sequence is unquestionable. The world indoor record. Nothing has ever gone this fast. So doing, and under the president's leadership, we're in phase 1 faster than ever before, according to Dr. Fauci, and that's people.
In the budget, and then there's really no other point person. I mean, I know the president ultimately, I guess the buck stops with the president, but he hasn't put somebody on the.
I'm not going to get into any details as to exactly how that works, but just rest assured we're on an accelerated pace to a vaccine, at least for this phase 1 portion of clinical trial.
The budget?
Yes.
Thanks. The Fed yesterday that appeared designed to allow oil companies to access their lending facilities. So I'm wondering if the president has spoken to Chairman Powell about this, if he's happy about the move, and if the White House has additional assistance to the oil companies.
So I won't get into the president's personal discussions, but I would just note that the president is always looking out for the nearly 11 million American workers in the oil industry. I would also note that we're filling the Strategic Petroleum Reserve right now, 75 million barrels. So that's the only announcements I have on the oil front today. Yes, Talu.
Kayleigh, the president tweeted this morning about the protests in Michigan. The governor of Michigan president should work with the protesters. He called them very good people and said that they are very angry. Some of those protests I'm sure you saw included, heavily armed protesters, members of militia groups. I wonder if the president was speaking about those specific members who stormed the Capitol in Michigan when he talked about very good people.
Look, the president was referencing generally that in this country you have a First Amendment right to protest. I think that's something we all treasure here, and we should, rightfully. You have a right to do that constitutionally, but you must protest within the bounds of the law. He encourages everyone to protest lawfully, and also to engage in our social distancing guidelines, which we think all Americans should engage in.
Do you have any response to just the imagery of potentially storming the Capitol, going into face-offs with police officers, and intimidating in some ways some of the lawmakers?
Again, the president says, that we must protest lawfully and act within the bounds of the law. Yes.
Thank you for being here. When the president says we did a spectacular job, or when Jared Kushner talks about a great success, Americans see it as a lack of empathy. Do you understand the reaction?
Look, Jared Kushner has, first of all, done a great job for this administration. And what I would say to that is that when he talked about a success story, he was talking about the story of this administration, which is a story of mobilization, the greatest mobilization of American industry since World War II. We grieve for every American life that has been lost, but we want the American people to be confident in the response of this administration, and that is what he was referring to. The fact that in the average year, the healthcare industry uses 25 million N95 masks, and we have delivered 75 million N95 masks, more than 3 times our sector uses in a year. That's extraordinary. It's extraordinary that some in the media were saying that we needed 1 million ventilators, and this president we've needed far short of that so far. Not a single American has died for lack of a ventilator, and the fact that this president can look the American people in the eye and say, I am producing 100,000 ventilators this year alongside the private sector, 100,000 ventilators, that's 3 times what we produce in the average year. I'd consider that a great success on behalf of the American people.
I guess it's more about the tone that the policy...
We want to give the American people confidence that they have a federal government that is doing everything in our power to provide the necessary equipment to combat this invisible enemy. We grieve for the American lives. We've said that today. My heart breaks for those. I pray regularly for those who are affected by the coronavirus, but to the American people that you have a federal government under President Donald Trump that's going to step up and give the greatest mobilization of the private sector since World War II.
Yes. Thank you so much, Kaylee. Thanks for being here. President Trump mentioned the situation in Brazil a few times this week. Besides talks of Brazil, are there talks of, in terms of sending assistance to Brazil, sending PPE or ventilators to Brazil? And is President Trump planning to talk with President Bolsonaro?
The president has mentioned that he has sent ventilators around the world. Any excess supply, we certainly look to help other countries. But, in terms of announcement regarding Brazil, I don't have any new information for you on that front today.
Yeah, Kaylee, welcome. One of the most important parts of your job, though, is to have access to the president. Can you give us some indication that since you've been named press secretary, what kind of access do you have to the president to get what he's thinking and relay it to us?
Yeah, I can tell you this. I'm around the president almost the entire day. I was just with him before I left to come out and speak with you guys. I think my staff can attest to the fact that they have a very hard time finding me because I'm in the Oval Office. So I'm consistently with him, absorbing his thinking to bring you the mindset of the president, deliver those facts so this president gets fair and accurate reporting and the American people get fair and accurate information. Yeah.
Thanks, Kaylee. Just following up on Kristen's question, China's blocking the World Health Organization from coming in and investigating how this started. Shouldn't external investigators be allowed into Wuhan to determine, 1, how the pandemic started, and 2, maybe a way that we could expedite finding a cure for this thing?
Look, there's no secret that China stopped U.S. investigators from coming in. It was of paramount importance that we got into China in an expedited fashion, and that didn't happen. With respect to the World Health Organization, they have some questions of their own to answer. The United States, as the president has emphasized, about $400 million to $500 million per year to the WHO, compared to China at roughly $40 million a year. But yet the WHO appears to have a very clear China bias. I mean, really damning for the WHO when you you consider the fact that on December 31st, you had Taiwanese officials warning about human-to-human transmission. The WHO did not make that public. On January 9th, the WHO repeated China's claim that the virus, quote, does not transmit readily between people. That was quite apparently false. On January 14th, the WHO again repeated China's talking points about no human-to-human transmission. They praised China's leadership on the 22nd. They said, and this is incredible, the pandemic didn't represent a public health emergency of international concern. And even on February 29th, you had the WHO saying that when the coronavirus was spreading around the world, they chose to put political correctness first by opposing life-saving travel restrictions. The travel restrictions this president put in place, Dr. Fauci praised as saving lives. And you have the World Health Organization oppose a measure that saved American lives. That's unacceptable, especially at a time when the U.S. was providing $1 million. John.
Kayleigh, this time last week, the president was saying that he was not happy with Georgia's Governor Brian Kemp for beginning the reopening process in the way that he was at the time that he was. A week later, there have been some peaks and valleys in new cases in Georgia, but overall the trend line is down. The president's thinking about the Georgia reopening as of today.
Look, the president, that the states take the lead here. It's the decision of governors to decide what is best for their state. That being said, I talked to the experts. I talked to Dr. Birx. I talked to Dr. Fauci, and they say, rightfully so, this president has always sided on the side of data, which is why he encourages all state-given guidelines to reopening. All states from Georgia on down the line should follow those guidelines. Ultimately, it is the decision of the states. And one note I would make about the president, in times of national emergency, we seem to have had a trend in this country where presidents aggregate power at the federal level, but this president has devolved power. He's invested in a principle that I cherish, and I know many others do, which is federalism and decision.
Has he mentioned how he feels about Governor Kemp in the last few days?
I have not spoken to him about government in a few days.
As the on the lines of reopening, as the president pushes forward to reopen the country, does that mean he'll be campaigning in those states where that will be reopening?
So I would refer you to the Trump campaign on that question. Yeah.
Yeah, thanks for being here, Kayleigh. You mentioned Dr. Fauci a minute ago. Are we going to have any more press briefings with Dr. Fauci and the health experts, or is the White House kind of shifting the message to focus more on the economy and less on the public health aspect?
Well, let me back up and talk to you a little bit about how we approach disseminating information. When I talk with my colleague Alyssa and we plan out the communication strategy for this White House along with the president and Ben as well, what we do is we say, what is the best mode for the public to receive this information at this time? And we allow the news cycle and the needs of the American people to guide us. And at the moment, what we see happening, and I hinted at this in my gaggle last week, is you have 35 states, and probably more at this point, with plans to reopen. Americans are looking to reopening the country. We've had Dr. Birx in several events this week. They've Fauci out on the airwaves. They're really incredible people and have done a great service for this country. But we allow the news of the day to guide us, what the American people need to hear. And right now we're in a reopening phase, which is why you've seen the president this week with CEOs. You've seen him with small business owners, with small business employees. Today with some great heroes emerged from this pandemic and have done a lot of the hard work. So every day we approach this as, how can we disseminate this information? There's a need for information, which is why I'm here, supplementing the efforts of this president to get the message out. I would also note he's the most accessible president in history. Took questions twice yesterday, twice the day before, often, as well as our medical experts.
So is the task force still meeting? I guess what's the role of the coronavirus task force? We still have hundreds of people a day are dying. What role does the task force have versus the economic advisory groups?
Yeah, the task force meets regularly. I go to those meetings. I hear them. Dr. Birx, I should say, is meticulously reviewing the data and granular. I watch them spend sometimes the upwards of 2 hours in these task force briefings. So those are still ongoing. Rest assured, we want a safe reopening. So we are prioritizing the health of the American people as well as looking forward to reopening this country.
Yes, thank you, Kayleigh. Back to the DNI statement from yesterday, there is a quote that I'd like you to give. The intelligence community also concurs with the wide scientific consensus that the COVID-19 virus was not man-made or genetically modified. This was from the DNI statement. How do you see this statement? How do you understand this? And also there was a piece in the New York Times that said senior Trump administration officials have pushed intelligence agencies to to support the theory that COVID-19 was made in a Wuhan laboratory?
I can assure you that no one is pressing the intelligence community to come to a determination. The intelligence community statement stands. It's in perfect concert with what the president said. So, you know, I encourage to convey the facts to the American people, which is that we're in line as an administration and we stand by the intelligence community, and that is in complete concert with what the president said yesterday. See, who haven't I gotten to? Oh, I've gotten to almost everyone. Okay, so we're in round two. That's great.
Thank you. Today, former Vice President Joe Biden denied allegations of sexual misconduct against him. Does President Trump take him at his word, given that, as the president has said, he has denied allegations against himself?
Well, what I would say is that we are pleased that the former vice president has decided to go within, 16 hours to follow the advice of the president of the United States and come out and publicly address those claims. So, you know, we're glad to see that he's on the record on this.
Let me just ask you about something the president said moments ago in an interview. He said that Tara Reade is, quote, far more compelling than anything they had with respect to Brett Kavanaugh. What do you mean by that? What is more compelling?
You know, that's the president's assessment, so I would point you back to think it was a grave miscarriage of justice, what happened with Justice Brett Kavanaugh. There's no need for me to bring up some of the salacious, awful, and verifiably false allegations that were made against Justice Kavanaugh. That was an embarrassment for the Democrat Party to have dragged the name of a very respectable man through the mud like that. So I'll leave it at that.
Yes, Kelly, as the radio pooler, I'm asking this on behalf of Kelly. There's word the decision to release Michael Cohen from prison to home confinement due to COVID-19 has been reversed. Did the White House directly or indirectly
No. So absolutely not, I would say there. But I am glad that you brought up justice, and because, look, there's, again, a case of injustice that is yet to be brought up today, but I certainly would like to bring it up, and that's the case of General Michael Flynn. What we've all learned from that should scare every American citizen. The fact that you had Jim Comey admitting in December of last year that he violated a protocol by directing agents to confront Flynn, something that he would not, quote, have gotten away with under previous administrations. The FBI told Flynn he didn't need a lawyer when they came to meet with him. FBI agents that he didn't think Flynn was lying. And then all of that information we've learned over the last few months and years culminates in the fact that we have a handwritten FBI note that says, quote, we need to get Flynn to lie, quote, and get him fired. There was an unfair target back of General Michael Flynn. It should concern every American anytime partisan pursuit of an individual, and that's certainly, at least those questions are raised with regard to General Michael Flynn, an honorable man who served his country. John.
Yeah, Kelly, and fired Michael Flynn. He said he was doing so because he had lied to the vice president and he had lied to the FBI. So, given all that you've just said, isn't it the president still believe that Michael Flynn lied to Vice President Pence and lied to the FBI?
Well, first, let me address that. Vice President Pence is on the record about this. He said he's inclined to believe that Flynn did not intentionally mislead him. And I guess I would turn the question on you and just ask, does it trouble you that the FBI said, we got to get Flynn to lie? Doesn't that trouble you as a journalist? And not only that, as an American citizen.
Well, it's certainly something worth reporting. It's not my job to say troubling, but the bottom line is the president said point blank that Flynn lied to the FBI and to the vice president. And I'm just asking a very direct question. Does he still believe that Michael Flynn lied to the FBI and lied to the vice president?
And again, I'd point you to the vice president's statement that he's inclined to believe that Flynn did not intentionally mislead him. And I'm asking back that all of you in your coverage endeavor to report what is a very scary story when the FBI is saying, let us get someone to lie. I've seen very scant coverage of that. It's a story worth reporting, and a story I haven't heard it yet are getting to hear for the very first time.
Chanel? I think he lied still.
Thank you, Secretary McEnany. Going back to the South China Sea, we had initially had the USS Barry crossing international maritime waters, and then this is in the South China Sea. And Chinese officials are saying that this will be a dead-end endeavor. Has the president spoken with any side on the Chinese as far as what the United States, U.S. Navy going to just ignore these threats and keep going through these international waters? What are your responses to China's increasing aggression in the South China Sea.
No news to report as to the president's conversations, and for the specifics of that, I would redirect you to the NSC. Yes.
Thanks. In the same podcast interview, the president said that Democrats would, quote, have to give us a lot for aid to states. I'm wondering if you have any idea of what specifically the White House is asking for, and secondly, what you'd say to somebody like Governor Cuomo. The president's already told me, a few weeks ago that he would support this type of assistance, and now, airlines or defense contractors, but not the states that pay teachers or first responders.
Well, first, you brought up Governor Cuomo, so I just thought it's a good time to remind everyone that Governor Cuomo has praised the president's response in this COVID-19 crisis, saying that what the president has achieved is a phenomenal accomplishment, and we thank Governor Cuomo for those very kind words. But on that note, with regard to funding to states, war is something that we want to start negotiating on immediately and get to work on. The president has said, look, I will certainly look to consider helping states who have coronavirus reasons for the financial situation they find themselves in, but he doesn't want this to be an excuse for decades and decades of bad Democrat governance that have run some of these state financial predicaments. So he has mentioned that in terms of the types of things he wants to see in this phase 4. I don't want to get ahead of the negotiations, but I do want to emphasize that he has mentioned sanctuary cities. This is a really important issue that has cost American lives. Last year, a brave ICE officers arrested more than 120,000 criminal aliens charged with nearly 10,000 burglaries, 5,000 sexual assaults, 45,000 violent assaults, 2,000 murders, and in the last year, egregiously, 5,000 episodes. So American lives matter, our brave ICE men and women matter, and it's something that he's mentioned he'd like to see in a phase 4.
I mean, you raised that, and the president's been kind of vague about this. Are you explicitly conditioning state aid on states or cities not saying that they have sanctuary city policies?
No, I'm not. No, not conditioning anything, but saying that is a negotiation item that the president will certainly bring up.
Thanks very much. So the president has in the past denied any of the allegations from the many women who have accused him of sexual misconduct. But per that podcast today, he seemed to suggest the allegations that Tara Reid has raised are more, what did you say, credible than the ones against Brett Kavanaugh. What about the allegations that were raised against him, however? Why should the public, or what makes them any less credible than the allegations from Tara Reid?
The president has swiftly denied all of these allegations that were raised 4 years ago. He has always told the truth on these. He's denied them immediately, and you're bringing up issues, like I said, from 4 years ago that were asked and answered, and the American people had their say in the matter when they elected Trump as president of the United States. But, the media, leave it to the media to really take an issue about the former vice president and turn it on the president and bring up accusations from 4 years ago that were asked and answered in the form of the vote of the American people.
Just come back, Haley, to John's question, because Kellyanne Conway spoke to this the other day and suggested that two things could be true at the same time. We now have the vice president saying it's his belief that General Flynn may have intentionally misled him. That's now 3 years after the fact. But the two things that could have been true at the same time were that Flynn lied to the vice president and also lied to the FBI. If you remove the FBI piece of that, would the president still have fired Michael Flynn for his bad point to the vice president?
I mean, I'm not going to engage in a hypothetical, and that's essentially what that would be. Bay is echo yet again that this was a grave miscarriage of justice. I'm very glad that the FBI thought to keep a paper trail, because what many have said for a very long time, pointing to the first few facts I shared with you, culminating in that handwritten note, I'm glad they kept such good documentation of their intent to slow walk General Flynn into a trap and to essentially create, as I mentioned, a grave miscarriage of justice. So at least we can thank you for the great note-taking.
Let me follow up on that, though. John does bring up the point. Flynn pleaded guilty to lying to the FBI.
I'm not going to get involved in what was a matter of
justice, though, in a sense.
Do you know miscarriage of justice when you have the FBI writing, "We want to get someone to lie"? Is that a miscarriage of justice?
But in the end, he pleaded guilty, and then that's...
You hesitated because you know what the answer is. The answer is yes.
That's up to a lot of other people to
and I would
decide.
encourage the media to cover it, because I've watched a lot of your networks, I've read a lot of your papers, I've seen a whole lot of information about Michael Flynn, when there was a whole lot of speculation about Russia, culminating in $40 million of taxpayer money being lost, and the complete and total exoneration of President Trump. Thank you guys so much. I'm going to cut this short now and go see my little 5-month-old here in a few hours. And let me just say this. The president at 5 p.m. leaves today for Camp David. Working weekend, he'll be talking with heads of states, with elected officials. We have a great event. And, of course, everyone should watch the Fox News Town Hall with the president from 7 to 9 p.m. It'll be Miss Television, much like the highly rated President Trump coronavirus task force briefings have been. Thank you.
Continue to see that, in spite of some little bit ups and downs, continue to trend down, helpful and important for us at our public health measures table.
Next question.
This question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Thanks so much. Dr. Williams, the province's ISIS data shows that the method of transmission is still pending, that onset as far back as mid-March. At time or shortly after, or when exactly did public health units sort of become overwhelmed and lose control of the containment strategy?
Right. I think I heard it was a bit muffled. So as I said before, we were, as you look in February, even though we had a lot of people coming back in from Wuhan, China, we had a lot of people coming from Europe, Italy, Iran, other countries and that, and people came forward and gotten tested, and we contained it up to then. We were looking at 60, 80, 90 cases, new cases a day. We trended up. And then about that time around the 10th, 11th, and 12th of March, when we started seeing the returning of people on some had the early March break, and then we closed the schools, or the March break, the idea, and the 13th of March, if you recall. And then we started seeing even more, and the amount of returnees during that time became extensive, and these are people returning from what they had assumed was mostly from the eastern seaboard of the U.S. Infectious area, but obviously it was, as we found out. That large influx started bringing a whole bunch of cases back in that overwhelmed the case contact system, because we had about, over a period of a week and a half, about Ontarians returned to Canada from the USA and from some other sites abroad, but they were already closing down international travel at that time.
Follow up?
Yes, thank you. And what will you have, what resources will public health units have as the economy starts to open up?
Right. So what we have is, of course, we have a lot more testing capacity than we did when we started into this back in early March, 3 times. And so that's available. We also have, looking at with a whole bunch of teams and committees, looking at our data systems, looking at the rigors and aspects and various components of the case containment management system throughout our 34 public health, how we might assist in that regard. So ramping up, because case containment has many components to it, and we need to look at all those, and our command table is assertively addressing all those at this time. And with the anticipation as it comes down, we can then really jumpstart that really aggressively and move on that. The survey in our long-term care facilities, our child care centers, as well as anything we have to do with congregate settings. Still doing outbreaks, still looking at geographical settings and that aspect there. So all efforts are being put in there to make sure we have a machine and an entity and the staffing that can really aggressively work at this, because it's going to be with us for the next 6 months to a year at least with COVID-19.
Next question.
Your next question comes from Phil Perkins with CHCH News. Please go ahead.
Hey there, Doctor. Okay, quick question. So on Monday, we released the framework to slowly bring back the economy. Reaching stage 1 would require at least 2 weeks of a decreasing amount of cases. It's less than a week. We're now allowing some businesses to come back. So are we technically now in stage 1?
Stage 1 would be where we relax the current public health measures that we put in, and that's the 6-foot distance preferentially, not in crowded settings, all the aspects about droplet spread and protection in that area there. If you go to stage 1, you'd start to relax some of those numbers. We're still saying groups, so we haven't eased off those. What we're saying is that if any of these things that are being considered now, they have to continue to maintain and do that. Can you do that? The next stage 1 would be saying, if you can go down and the community spread has decreased and there's containment in place and there's a number of metrics, not just one, can we say that now some larger type things can happen, and that, because that's what the public want to be persuaded to say, if for now in this type of setting, can I be assured it's okay? And what kind of information can you tell me that says in this sort of gathering or group, I feel safe enough, and what do I have to do to protect myself? Still keeping me in my 6-foot distance, I may choose to do that. So we're not in stage 1 right now. We're still doing the same one. These ones announced by the Premier today are all would still continue and need to do those guidelines and those directions as now.
Follow up?
Okay. And I think you mentioned it earlier this week, recommendations for those who are, privileged enough to have cottages. People have mentioned this weekend, looks like it could be pretty nice, especially on Sunday. On those recommendations for those who might want to go up north?
There wasn't anything definite from the Premier today in that regard, because as you can imagine, this involves our provincial government as well as local governments and municipalities and mayors and councils who have different concerns from different areas in that matter there. My position in there is that can that be done? The concerns and issues and maintaining our public health, that if someone has a real, like an urgent need to go up, something's happened to their facility, their cottage, some damage or whatever, they have to go up and quickly look at it and come back down again, or do something they would do so when they're not ill. They make sure they bring all their supplies with them. They don't stay for a prolonged period and don't. And it's an essential visit to deal with a matter that needs to be looked after. My sense is that would fit that category, but then the concerns from some of the local ones, would that be followed? Will it be handled? And I don't have a direct answer for that, and that's part of, I think, the consultation would have to take place between the provincial government and the local municipalities to come up with an agreed-upon approach to the whole matter. As you say, it's getting closer to the usual I guess, annual time when people talk about the May 24th weekend is when people talk about, I think, the cottage lands and areas opening up in large amounts.
Okay, we're going to move to the last caller on the line.
Your final question comes from Mo Fahim with Vista Radio. Please go ahead.
Thank you. Good afternoon, doctors, and good afternoon, doctor, and happy Friday. My question is regarding second infection. So we've been hearing a lot of reports about it, and I believe a CBC article, Vancouver individual who did report getting infected a second time. Are there reports of either like normal anybody from the public getting infected a second time, or a healthcare worker getting infected a second time here in Ontario?
I haven't had them here in Ontario, and what I would say is that when you say infected, usually means the person's had a second time a positive test. And I think some of the confusion, we've tried to be clear on this, and this is a bit challenging. The test itself detects bits of RNA from the virus in the person's nasopharyngeal passage. Those may be other pieces therein. So a person could be tested and then be assessed, and someone else contaminate them again and have a second test. What you really want to know is that if a person who infected, and that's harder to ascertain because we don't do blood cultures and looking for the so-called viral infection, the title is viremia, that would stimulate a full immune response. We don't have that kind of data available to us. So I would say we have to be careful. A person who was tested positive could be tested positive again. Were they really infected, yes or no? That kind of clinical detail has to be carefully assessed, and that's why we're looking at aspects of quality serology, some sense of if people were infected, do they have immunity, and can someone have immunity and then not be infected again? You may, by happenstance, have some viral particles left in your nasopharyngeal passage. Your immune system has eliminated it being spread to the body, and your PCR test could be positive. That may sound confusing, but we're just saying, what is the value? Most of the time we say when people have it, it's usually our best sense of when they're infectious, especially when it's combined with symptoms. And that's when we say, that's our best measure. You have a test positive, you've had symptoms, you've had travel in the past, and the symptoms, we've widened the definition because we found that some people with very mild symptoms or some newer types of symptoms that people reported, so we've widened that to do testing, because then if they have symptoms, general symptoms, fever, ache, myalgia, it has to be evidence of, probably clinically, they've had infection internally, and so we take the two together as being much more evidence of a infection in that sense. So I don't know if that helped you or did it confuse you?
I think that actually helps a little bit. I'm going to move on to the follow-up. Kind of touched on talking about new symptoms. So in the United Kingdom, clinicians kind of released a memo to keep an eye out for this COVID toe in children. Has this surfaced in Ontario? What does Ontario Public Health, what does Public Health Ontario know or is kind of doing regarding this?
Public Health Ontario has read the reports and seen them. We have consulted, of course. We have our leading center here with Hospital Physician to ask them if they've seen any cases in that. So they're reviewing the matter and want to be aware of it. Our information so far, it is a frequent event. Nevertheless, it doesn't preclude us from talking to our world-class experts at Hospital for Sick Children, combined with Public Health Ontario, to give us the best information possible and to assess that, and then to be able to give some evidence-based advice, that a reasonable risk assessment and aspect to the public who may be wanting. So I haven't got the final report on that particular condition. I know they're looking into the matter at this time.
Okay, thank you, everyone.
Chinese naughty boy always make noise, playing in the tweet, kicking ass by the tightest day. You've got coffee delay, you beg disgrace, cause you only know this cheating phrase. Say it. Rock you! Yeah! Chinese naughty boy always make noise, playing in the tweet, kicking ass by the tightest day. You've got coffee delay, you beg disgrace, cause you only know this cheating phrase. Say it. Lima Sila Lish. Yeah. Chinese naughty boy always make noise, playing in the tweet, kicking at the tightest day. You've got coffee delay, you beg disgrace, this cheating phrase. Say it.
执迷如非爱，剥俗了非我被演出来。时间被安排，演一场意外，令它快走开。出事在阵外，媒体跑不开，看白。你听不出来，风声不存在，被细心灌溉。晚上来，是谁在窗台把真相传开？那表如残意的欢在，经不起来摘。我送爱千里之外，去感染黑白。我眼下呆，管他不该，要是受伤害。我送你离开天涯之外，你原地爆开。路从何来，生死难猜，用一生去掩盖。聚散之外，此地无黑失败。这么多的资讯，边缘体只怕被刺穿之外，此地无言我的年来。看飞片变白，人命如尘埃，当给你的爱。研究刚出来，自爆了悲哀，我被爱。谣言随便猜，意愿随便改，都救不回来。真相被覆盖，最少就花开，过去成空白。隔离一下台，把谎言散开。意大利和中国的奶，被毒也是活该。我送你离开千里之外，感谢他的伞。这个年代，管他不该，支付宝才实在。你送我离开天涯之外，独从何来，生死难猜，用一生。我送你离开千里之外，去感染黑白。 不该要是接受伤害。你从离开天涯之外，我原地爆开，不从而来，生死难猜，相信当死得快。
We cannot tolerate that. But since I don't have any inferiority complex when I am personally affected or attacked by racial slurs, I don't care because I am a very proud black person or Negro. I don't care being called even Negro. I am. That's what came reporters. And if you want me to be specific, 3 months ago, this attack came from Taiwan.
他在电视说的只是个离歌，因为他的肤色是黑色。你要我怎么说？是否我有看错？你在空中随着。
Or racist comments, giving me names.
世衛有個飛的少一個中國的大哥，他自己很配合，當一個歌頌者，每天為中共舞着。怎知道武漢整座城市顛倒？他說不用口罩，沒想到病毒成我的國。第一天就說大事不妙，一個不停從台灣宣告，病人不用奔跑。沒想到最後誰都會病倒，機會嗎？全都是台灣網軍在胡鬧。
Didn't even respond. When as community people start to insult us, that's enough. That's enough. We cannot tolerate that.
世衛有個非洲的小李哥，他說外國封關不適合，他自己在剎車。 以為在唱謠舌，每天為中共舞着。怎知道讓整座城市顛倒？他說不用口罩，沒想到病毒全世界得到。我的國一天就說大事不妙。 如果立刻聽從台灣的勸告，病人不用奔跑。沒想到最後誰都會病倒，機會嗎？全都是台灣網軍在胡鬧。怎知道武漢病毒讓整座市顛倒？他說不用口罩，沒想到病毒全世界得到。 我的國第一天就說大事不妙，如果立刻聽從台灣的勸告，病人不用奔跑。沒想到最後誰也都病倒，只有我都守在台灣安心的睡着。
We will do everything right in WHO. We will do everything that can. To serve humanity. We will do everything that will help. No regrets.
Stay home and only venture out for essentials when absolutely necessary. People are resulted in considerably fewer people being out and about in our city, thank goodness, because we stopping the spread. We cannot thank enough all of the residents who are and staying home as much as possible. And while I recognize that a lot of this reduced activity, the virus itself, the shutdown, the lost business, it does at the same time present us with an opportunity. With traffic volumes down between 45 and 66%, logical measurement of this now available on many city streets, this presents an unprecedented to accelerate as many of the city's major planned construction projects as possible as we kick off our summer construction season, to get the work done while things are quieter and to get some projects done before things get busier again. By taking a bold and aggressive approach to construction this year, we will ensure that the vital infrastructure that is used by millions of people in Toronto every day will remain safe, in a state of good repair, and as ready as possible for when the restart and recovery begins, hopefully not too long into the future. This kind of construction is considered an essential service by the province of Ontario, and by continuing with the city's planned projects, it will provide important opportunities to support the local and provincial economy and the construction industry. And of course, our construction workers in many cases have been on the job pandemic. This will enable crews, drivers, suppliers, and others in the industry as it has to continue to work during this period of time, always in a safe environment which respects public health imperatives. This year, the city will both start new projects and complete 2019 work, which will bring some level of construction to more than 550 streets across Toronto. This work will make repairs to Toronto local roads, sidewalk and cycling infrastructure, improve public transit infrastructure, replace and rehabilitate water mains and sewers, and build and improve major water infrastructure that will in turn help to improve Toronto's waterways and stormwater. I've asked city staff to work to accelerate as many projects as possible, making our roads available for construction, alleviating restrictions on roads and intersections during peak and off-peak hours on means and methods they can take to complete these projects within a fast-track schedule. Now is the time to accelerate and move forward more rapidly with fewer restrictions. Some of the major projects that will be accelerated include Bathurst Street, from where bridge rehabilitation, TTC track rehabilitation will result in a full road closure starting May 17th. The replacement of a 143-year-old water main on Bathurst Street, Queen West. Replacing a 143-year-old water main and TTC track requiring a full intersection closure on Church Street at Richmond. Rehabilitating the Don Mills Bridge over the Don Valley Parkway. And completing the replacement of a 146-year-old street from York to Bathurst. In addition, other projects that the city is now looking to accelerate this spring through working with the contractors and advancing the tender process because of the quieter traffic conditions include road reconstruction and water service replacement Avenue from Danforth to Lawrence, road resurfacing, sidewalk and curb construction on Martin Grove from Finch to Albion, road reconstruction, sidewalk construction and upgrading cycling infrastructure on Shooter from Sherbourne to River, replacement of a 140-year-old water main on Bathurst from Front to Queen West, replacing a 131-year-old water main pond to Bloor Street West. This is just a sampling of the significant projects, much more of done during a time when you are not using the roadways and they're interfering much less with traffic, which hopefully can return more to normal when the economy. The city is also continuing our program of maintenance on bikeways and on sidewalks and roads to keep our infrastructure safe. City crews are also making daily pothole repairs with more than 12,000 potholes fixed in April despite restrictions. We'll be putting the hurry up on potholes this month on both streets and bike lanes. Beyond the days are planned throughout May, starting with one tomorrow, Saturday. Annual spring maintenance on the Gardner Expressway at the end of this month, better to do than later. Since March, when reduced emergency period traffic levels began to decline, the city's work zone coordination team has been actively meeting with private contractors and utility companies to help accelerate their work by approving 600 rush hour exemptions and extending work hours, which also supports worker safety. And while we have ambitious plans to make the most of lower traffic volumes, we recognize COVID-19 presents to the construction industry and to workers in terms of keeping them safe and healthy. The city continues to be committed to working with the industry and with the unions to ensure contractors adhere to public health guidance for the health and safety of all workers. This is another example of common sense action that the city is taking during the COVID-19 crisis to help as much as we can. The work has to get done, and now is the time to get as much of it done as we possibly can while traffic levels are reduced. This is both sensible and safer. And while you continue to adhere to the advice, I am committed to getting this work done on your behalf and getting it done as quickly as possible so that it is ready for all our residents and businesses when we come out on the other side of COVID-19. We're underway right now to address sidewalk hotspots through Curb TO. I've asked city staff to look at more active transportation as a crucial part of the restart and recovery. Our streets are going to look different in many places in the post-COVID world. And I want to thank City Council for your view yesterday. The General Manager of Transportation Services and the Medical Officer of Health to pursue opportunities together to provide, where possible, the advice of public health and through the citywide recovery planning process, more space for pedestrians, cyclists, and transit riders to allow for better physical distancing. Council also asked Transportation Services to report back on the possibility of fast-tracking projects within the 10-year capital plan for both Vision Zero, our pedestrian and cyclist safety program, and for cycling infrastructure itself. While it isn't my favorite part of being mayor by any means, this emergency situation is changing the way we do many things, including for this year, how we will celebrate Canada's birthday. It falls upon me to share the sad but I believe sensible news with you about Canada Day in Toronto in 2020 and latter communities to reach this unfortunate conclusion as opposed to one of the first. Based on our Medical Officer of Health and so as to stop the spread of COVID-19 and save lives, we will be promoting participation in national virtual Canada Day celebrations. And this also mean, of necessity, cancellation of all city-led and city-permitted Canada Day events in Ashbridges Bay, Centennial Park, Milliken Park, Stan Wadlow Park, and Weston Lions Park, Canada Day celebrations at Mel Lastman Square, Scarborough's annual Canada Day event, the Centennial Park Canada Day celebration, and the East York Canada Day Parade and Festival. Believe me, I am as disappointed as you are about the cancellation of. I would like nothing more than to tell you that we can celebrate the birthday of our great country as we usually do with the usual places, but we just can't this year out of caution and out of an overriding concern for public health. Instead of these traditional in-person events, the city communities across Canada to celebrate a virtual Canada Day on July the 1st. We will be working with the many community and cultural organizations who we traditionally partner with and to plan virtual Canada Day celebrations that will showcase Toronto, including tributes to our frontline workers in the fight against COVID-19. We will announce more details about the virtual celebrations in the coming weeks. I encourage residents to show their support and their love for our great country, Canada, in real life. Decorate your porches, decorate your balconies, decorate your front doors with a flag. There are ways in which we can show our love for our country in this year where we won't be able to be together as much. Wherever people are in the city, I would love to see them with Canadian flags everywhere, celebrating effort as a country to confront and defeat COVID-19. To celebrating virtually with Toronto residents on July the 1st, but even more, I look forward, as I'm sure you do, to the day in 2021 when we can celebrate these events in the manner to which we're accustomed. So we've made it through one more week, this one being made a lot of progress this week, but we have to make sure that we finish the job, and the job can be nothing less than conquering COVID-19. I know we can conquer it, and that is because I continue to believe, and every day has made me people of Toronto and what they can do together to conquer this virus. So while the weather this weekend, I know the majority of people will continue to do what they've been doing, which is stay home as much and keep their distance from each other. Leave your house to go for a walk or a run or to walk your dog. That's fine and good for you and for your dog if you have one. But please just leave it at that. Thank you for your sacrifice. You are helping us save lives. You are helping us get through this faster and get to the day which we're very actively now working with the province when we can reopen the city. I've used the term wartime speed a lot in referring to some of the things we've done with housing and other projects that have been done to give us a place where we can log our personal protective equipment and so on. I want us to get through the crisis at wartime speed. That way we can, as soon as it's safe, get back to Saturdays and Sundays the way we like them at this time of the year, real Saturdays and Sundays, having fun in our city. And on that note, I will to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. For today's update, as of 11 o'clock this morning, there are 5,687 people infected with COVID-19 in Toronto. This includes 5,035 confirmed, and 552 probable cases. There are 351 people in hospital, 113 intensive care units. In total, we have lost 369 Torontonians to this virus. On behalf of the team, once again, I extend my deepest sympathies to those who have lost loved ones, wish a speedy recovery to those who are sick. I've been asked to provide an update on the Jesse Ketchum Early Learning and Child Care Center, which is one of the city's 7 licensed child care centers that provide care for the children of essential and critical service workers. To date, 6 child care center staff and 1 child have tested positive for COVID-19. 2 children have tested negative for the disease. My team continues to work with Children's Services and Public Health Ontario to manage this outbreak. This includes reviewing the infection prevention and control protocols in these centers to see if changes can be made to prevent interest and April 28th. Staff and children who attended the center during this period are required to be in self-isolation for 14 days from their last day at the center. I also wanted to let you know that late yesterday, during a process improvement review, our operations team at Toronto Public Health learned that we did not conduct contact tracing for 52 positive COVID-19 lab reports received between March 31st and April 6th. I want to assure you that all 52 of these people were aware of their positive diagnosis at the time and appropriately isolated at the time. As such, there is no increased risk to our community and our population. This, unfortunately, because there was an error in how these lab reports were received. Upon learning of this matter late yesterday evening, I immediately asked my team to take action to correct the situation. I also asked them to determine how this happened and to work to ensure that it does not happen again. To being honest and transparent with you, not only because you deserve that from me, this is core to who I am. You are all my patients, and protecting your health is my top priority. Earlier this afternoon, it came to my attention that there may be calling residents in our community and falsely claiming to be from Toronto Public or being Toronto Public Health staff. In one instance that I just heard of, the individual was asked to provide their banking information and their social insurance number. My team would never ask you for this information because it is not relevant to our work. If you receive such a call, please do not share your social insurance number or financial information with the caller. Please instead contact Toronto Police Service matter. When a member of my team contacts a resident in follow-up to COVID-19 or a communicable disease, we would only ask information to confirm your identity and questions related to your health. If you have questions about a public health call, please contact our Toronto Public Health Hotline at 416-338-7600. In closing, as you've heard, we are anticipating nice weather this weekend. While I know we will all want to be outside, what continues to be best for our community, stay home as much as possible and to continue to practice physical distancing. Now, this doesn't mean that you can't go outside at all. What I'm asking for you is to limit your outings and to make sure that you are being careful about practicing physical distancing when you do go outside. This is the best way to protect and everyone around you. We need to continue our fight against COVID-19, and we need to keep doing what we can to reduce the spread of this virus in our city. So please continue to stay home, stay safe. I'll now hand it over to Chief Pegg.
Thank you, Dr. Davila. Excuse me, and good afternoon. I'd like to begin my remarks this afternoon by acknowledging that Mayor Tory declared today as both First Responders Day and Doctors Day, and thanking him for doing so. In my role as Fire Chief and General Manager of Emergency, I have the privilege of witnessing the service of our police officers, paramedics, firefighters, communications officers, and our healthcare professionals every day. Each and every day, our first responders and healthcare professionals give their all in service to others. This may never have been clearer than it has been during COVID-19. I extend my sincere personal thanks to each and every first responder and healthcare professional in our great city and every day. Earlier this morning, bonded to a fire under the bridge on Glen Road near South Drive. This is in the Mount Pleasant Road and Bloor Street East area of Toronto. Upon arrival at this fire, responding crews confirmed that the fire originated in a makeshift homeless encampment. Sadly, during the course of operations, one occupant of the encampment was located in the area involved in fire and was pronounced deceased. On behalf of all of us, I extend my sincere condolences to the family, friends, and all those impacted by this tragic loss of life. The investigation into the origin, cause, and circumstances of this fire is ongoing, with Toronto Fire Services, Toronto Police, the Office of the Chief Coroner, and the Ontario Office of the Fire Marshal, who are all working together. Life occurred. This is the 7th fatal homeless encampment fire in Toronto since 2010, and the first since April of 2018. This is also the 33rd fire involving a homeless encampment this year, and the 190th such fire since 2017. Since the onset of COVID-19, the City of Toronto has monitored encampment sites and removed dangerous materials such as propane tanks. While there has been a moratorium on clearing encampments during COVID-19, the city's Streets to Homes outreach team have also continued out, checking on people living outside and offering services such as options. On Wednesday, the city announced a new housing people living outside, with the availability of 125 units in 2 apartment buildings in Midtown Toronto. As of yesterday, 47 people have moved into units with 24/7 staff support, security, and case management, long-term housing, and other immediate needs, including harm reduction supports. This interim housing is a bridge to more permanent housing options. Encampments where individuals are offered this housing will subsequently be cleared based on existing protocols following the offer of housing. This afternoon, I learned that some people are encouraging those experiencing homelessness to move in for reasons I simply cannot fathom. This advice places the safety of our residents at risk. There have been 195 homeless encampments in Toronto since 2017, 7 of which have resulted in people losing their lives as a result. We are working hard to remove the risks and dangers that homeless encampments pose, and as the fire chief, I ask everyone to avoid providing this type of reckless and irresponsible advice that would simply place lives at risk. During yesterday's City Council meeting, the issue of our PPE pandemic stockpile was raised, and I would like to provide some additional background and information on this important issue. In 2008, Toronto City Council a pandemic influenza PPE stockpile. This inventory and related items was established over 3 years, between 2008 and 2010. This stockpile was designed to absorb an estimated 8-week influenza pandemic in Toronto. Since that time, although efforts were made to remained current and in place, a number of items in the previously established stockpile reached their best before dates. Some of those items, such as hand sanitizer, influenza antiviral medications, expired and were removed from active inventory some time ago. However, much of the PPE contained in the stockpile continues to be serviceable and has backstopped our ongoing response to COVID-19. In the past, we had believed an 8-week stockpile would be enough. COVID-19 has emerged as a much longer fight, requires much more PPE than anyone ever anticipated in the past. This issue has been one of the top priorities for our COVID-19 Strategic Command Team. In response to these command decisions, Mayor Tory has already asked that we immediately begin to plan to build up our PPE inventory as we prepare the city for the potential for a dip of the COVID-19 pandemic. I would like to acknowledge and thank our Purchasing and Materials Management and Emergency Operations Center teams for their tireless work in procuring and maintaining PPE throughout COVID-19. Our PPE levels continue to be stable. Our present inventory levels are as follows. We have a 41-day supply of respirators, a 199-day supply of surgical masks, a 56-day supply of isolation gowns, and a 20-day supply of face shields, with a large order of face shields incoming shortly. In closing, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Just for reporters, just so you know, on the line we have Michael DeAndrea, who heads up our engineering division, Marianne Bedard from Shelter Support and Housing, and Paul Raftis from our long-term care homes. First question is to Matt Bingley from Global News. Hi, Matt. Go ahead, please.
Good afternoon, Mayor Tory. I was speaking to an outreach worker who said that the 125 apartments that are working to house those living in encampments is a good first step, but saying that there's so many people living in these areas that it's just a bucket. I'm just wondering if the city is looking at this model and considering replicating it in other buildings throughout the city.
We're looking at a wide variety of options. It included the modular housing, 100 units that were authorized by the City Council yesterday, which we're moving ahead with dispatch, so that those could be occupied by as early as September. We obviously have been using hotel properties as we can. The housing program that is, I think, going to use upwards of 200 and some odd Toronto community housing units that were vacant, some of which were being refurbished. So we're looking at a wide range of options to make sure that people who are homeless are in conditions as best we possibly can.
Back after the fact and complete that work, or did it even make sense to do it at that point?
So because we actually knew that people were aware of their diet, self-isolated, there was no risk to the community, and we just checked in, made sure that people were doing well, and we have confirmed that today. So I think what this shows is that even within the context of a global emergency, you can really understand why it's so important to do these quality improvement processes, and that I'm pleased to say that our quality improvement and process improvement reviews at Toronto Public Health are working as they should.
Okay, thank you. We'll go to Dave Ryder now from the Toronto Star. Dave?
Hi, first question for Mayor Tory. As I believe that Canada Day celebrations are the first major cancellation Toronto has that goes past June. There's lots of city recreation programs that I tell you in July and August, and lots of parents who in the past have relied on those. Can you tell us when we will know, or if you tell us now, if those events, recreation events in the summer are going ahead?
I can't tell you yet about the summer camps for two reasons. First, we've been looking obviously at the whole situation with the pandemic and how it's unfolding and how the numbers are going, because it'll fit in like everything else with the considerations of with programs that would happen in a better time health-wise, and we'll obviously rely on the guidance of our public health officials for that, as we have throughout. But secondly, we are also looking at, within that context, looking at ways in which we possibly could operate camps on some kind of a different basis. So, you know, kids are kids, and if kids are going to be, if you're going to try to explain to them the context of physical distancing, good luck in some cases. So it might mean there would be a way to do a camp with fewer kids or with more staff or some other kind of model. So we're exploring that, I guess, always trying to make sure we cancel the camps unless we have to, but we should obviously have that information in the interests of those planning and the camps, those with children that might attend the camps, and those who would work at the camps as soon as we possibly can, and soon in any event.
Thank you. And my follow-up question is for Dr. Davila, and that's, Dr. Davila, with no vaccine on the immediate horizon and any hope of sort of mass herd immunity soon, can you just address what that means for Toronto, even as we start to move back to some sort of phased normal as far as large those, until we have an assurance that this disease won't just kind of roar the community?
Well, as it turns out, that's an interesting, but it's not one that is exclusive to Toronto. I think when we look at the circumstances around the world, we recognize that we are all grappling with this very issue. What I think it comes down to is that until such time as we get, very effective and definitive treatments for COVID-19, and until such time as we have a vaccine available and actually implemented and used broadly to protect the population, we are all trying to figure out how best we can continue to live safely with COVID-19 in our community. So that's the work of our recovery and rebuild team. I don't think that that's something that's exclusive to Toronto, and you can be sure that we're speaking with counterparts all over the world to help inform our efforts in this regard.
Mark McAllister from City News. Mark?
Thank you.
Okay, thank you, Mark. Final question then is to Beatrice Vaisman from C.
Mayor Tory, my question's for you. I know you've been working Premier in terms of developing a plan to reopen the city without committing to any dates. We saw the province at least put forward a framework to begin reopening the province. What kind of work is going on behind the scenes right now to make a plan to reopen Toronto, and when can we expect to see that plan, that funding revealed?
Well, first of all, our objective, if at all possible, taking into account there are some differences, obviously, with the biggest and densest, most densely populated city in the country, our objective is to have our plan follow along with their plan to the greatest extent possible, because it's less confusing for people, and it just makes. Secondly, we are working hand in glove with them to the maximum extent possible. So I'll give you an example of that. They announced the opening up of community gardens, which we welcomed. Work out the guidelines, which have been very actively worked upon by our public health people, by our Parks and Recreation people, and a host of others, such that we can have news on all of that available and have those gardens open shortly. And of course, now that they've made some other announcements today of a period of preparation that's allowed for different kinds of businesses, marinas, golf courses, garden centers, and so on, we will continue to work actively with those businesses and with that government to make this in the interest of public health, but also getting the economy open up as soon as possible. In the case of the golf courses, we've been doing what we have to do to keep our golf courses kind of organized during the time when they've had to be. But we're now, like everybody else, as the owner of, I think, 5 golf courses, able to move forward and do the preparation, waiting for the good results to come on the tests and whatnot, so that we can open those passes the threshold that Mr. Ford also had in his plan. So we're trying to work with them on everything we can. Plus, we're doing all of our own work to have our own plans that are unique to Toronto, such as how our transit system, for example, is accommodating the circumstances of an opened-up city and up to Toronto.
And my second question, Mayor and Dr. Davila, you can both comment if you'd like, but I'm wondering, of course, we've had some pretty mild days already. This weekend set to be a beautiful weekend. You both touched on it in your opening remarks. We've heard a lot of hope in the last few days, both from yourselves and the Premier, that we're turning a new leaf and the situation slowly getting better. How worried are people are going to take that hope and turn it into a cue that it's now a little safer for them to be outdoors? And just as a secondary question to that too, how about now potentially even going up to the cottage, just end up at the cottage?
I think the Premier and a number of the municipal leaders outside of Toronto have discouraged people from going to the cottage just yet, because there's a whole bunch of reasons into the spread of the virus and in terms of stresses and strains put on local infrastructure there, both health and otherwise. And I hope people will, by and large, heed that advice, those that haven't been sort of staying in put in parts of the province other than Toronto so far. With respect to the fear of people backsliding, as it were, I think people got the message. I think they're so anxious to have this city opened up and to have good weather and bad, also able to be days in which you can go to a bar, go to a restaurant, go to a go out for a walk in the park without any restriction at all, that they're going to apply maximum cooperation. Will there be a few people who don't? Of course, there's a few people who don't go along with on things, and that's just what you have to accept. But I think really more than ever this weekend, understand that they have to be a big part of the solution that gets us to the promised land and gets the city opened back up so we can enjoy what I described earlier on as real weekends coming up in hopefully not too distant a time.
Okay, thank you very much. That concludes today's briefing. We will have, again, with respect to case counts. Stay well, everybody, and we'll see you on Monday.
beautiful place. Mother.
你妈死了！你妈死了！
VPN to let them access Twitter. TMD they come out need to pay. In the page they will say 你妈死了 which mean your mom is dead in 普通话 Mind blowing, what are those people thinking? Our mouth are fully educated. What a shame, climb down over the gate just to show the series is gay. Talking freedom, no freedom กล้าฝ่ามันให้เล่นกันตามhave เลยสากันทุกโปรทำเลยสากัน shoot the front no they shoot the จุดจีรันใช่นะนี่มาเสียงเลี้ยวมาใช้สักตอนนี้ all woman disappear so lonely I begging they come back I have fan นี่มี wanna share but father again
操你妈！你妈死了！你妈死了！
Sorry at night we heard
你妈死了！
which mom 死了 We have 10 mom 啦
你说啥？
好 talking freedom, no freedom. 烏貓 just only condom, condom man just for fun. You are not the only one. 你殺緊 in them 冧，烏貓 shouting 自己人。Sorry 啊，姨媽是你啊，我笨仔啊，Suddenly, all 烏貓 disappear. So lonely 啊 I begging they come back. I have many wanna say ya, but brother see won't let them again. But brother see won't let them again. I see won't let them again.
唔好害人哋啲仔女啦！好心啊，啲行徑有乜辛苦？日日打黑色衫，打黑色衫，我哋嘅後生仔。好心啊，啲行徑天生咁樣，日日爭取打交，爭取打交，又破壞香港。打傳媒，打傳媒，打議員，打議員，打圈仔，打圈仔，打四黑警，打爛呢個家園啊！死黑警又唔做嘢，又唔讀書，死黑警點解我嘅唔做愛人嘅仔女？我唔得。全家仔女落下，死黑警，我冇罪㗎，點解要搞我咧？黑警就係我哋仇人，黑警日日鬧事，黑警黑警破壞香港法例，黑警就係我哋仇人，黑警日日鬧事。黑警破壞香港法例，黑警破壞香港法例，香港法例，香港法例。